And a very good afternoon, everyone. Welcome back to Issues and Attitudes. My name is Jeff Owens. My co-host is Corbin Cox.
Hello.
And today our guest is Zoe Due from Carle Hospital. She is a midwife. Welcome, Zoe.
Hi, thank you so much for having me.
Well, we appreciate you coming in on this Monday, first show back after the holidays and everything. And so Corbin and I were both naive going into this, and we've been doing a little research. But for other people out there who don't really understand what a midwife is, can you give us what it is you do?
Yeah, I love this question. So a midwife is a medical professional with a background in nursing. And then we go and get either a master's degree or sometimes some of my colleagues have a doctorate, and with special training in women's health. And we can do prenatal care. We can provide care for women across the lifespan, and we can attend deliveries, which is, of course, the most fun part.
Yeah, so how long have you been working as a midwife?
I've been working as a midwife since 2021, and Carle has had midwives for about 20 years.
And Carle's actually one of the bigger midwiferys in downstate Illinois, correct?
That's right. Yeah, we have currently 11 midwives practicing, certified nurse midwives practicing with our group, which does make us, one of the biggest ones outside of the Chicago area.
When did you know in your training or schooling that, hey, this is what I want to do?
Actually, I figured out I wanted to be a midwife when I learned about midwives and about prenatal care in the United States when I was pursuing a completely different degree at University of Illinois. I learned about all of the ways that sometimes women are not given agency in healthcare and in general, and it made me angry, and I thought that we could do better. And so I learned about becoming a nurse, about becoming a nurse midwife, and I made it my mission to keep doing that.
That's awesome.
Is this something that you see yourself like doing for the rest of your life, or is there some other thing you'd like to pursue, teaching, something like that?
I will absolutely be a midwife as long as my knees and back will let me, and as long as I can keep up with those overnight calls. I think I would also enjoy teaching. I've done a little bit of nursing instructing, and I'd also love to teach future midwives when I have a little more experience under my belt.
If you can you take us through like the day-to-day activities as you're kind of leading up to a birth, like what you're talking about to the parents, obviously to the mother-to-be, and working with the other doctors. Can you take us through the behind the scenes?
Sure. So prenatal care starts usually around 10 to 12 weeks, and people can self-refer to our clinic if they want to. And those visits start about every 4 weeks in the beginning, and then once you hit that third trimester at 28 weeks, we're seeing you more frequently. We're going to talk to you about how you plan to feed your baby, that making sure you have everything that you need at home. Putting people in touch with resources is an important part of what we do as well. We're going to talk about pain management options, what to expect at the hospital, things that we will offer you and your baby, and whether or not those are acceptable to you. We run routine labs. We do ultrasounds when they're indicated, all kinds of stuff like that.
Now, postpartum, after the baby is born, do you stay in touch with the parents, or how does that work? Is there work after the baby?
Yeah, certainly the most work happens after the baby, but we're not there for most of it.
Yeah.
We have gone from just doing the 6-week appointment, which is kind of the traditional model, to also seeing our patients at 1 to 2 weeks out for our lower risk patients to check on them, making sure that their feeding plan is working for them, that pain is under control, that they're not having any complications. And also the most important piece is that adjustment to parenthood, because taking home a newborn is exciting and wonderful, but it's also really stressful. You said that you're a father. You know that those early days are sleep deprived, and that's without the physical trauma of having a person come out of you. So we do like to touch base with our moms if we can.
Okay. Now, do you stay in touch with some of the ones that maybe you got to know closer than others, and you still, like the kids are, 1, 2, 3, or 10, or whatever it is now?
We do get a lot of repeat customers, and I think that's a testament to how we bond with our patients. Even though we're a big practice, it's very individualized, and you really get to know folks. So people come back to us for subsequent babies, but they also come back to us for annual exams and other care, and often they bring their kiddos along, which we love.
I bet you do.
Now, off camera, you said something kind of interesting to me because I am a twin. You said that midwives don't deliver babies that are multiples. Why is that?
That's because the midwifery scope of practice, which means basically what we're allowed to care for, is limited to lower risk folks. We're expanding the definition of that a little bit because we have the benefit of our excellent physicians at Carle who can provide us backup. So twins and triplets and higher order multiples are a little more complicated than the care that we're able to provide, but people with elevated blood pressure, even the early stages of preeclampsia, people with some other complications, people with previous C-sections are still appropriate for our care because we're able to collaborate with our physicians.
Have you ever had to, or can you take us through something maybe that was a really difficult part of the job that was tough that you can kind of tell the story without the names, obviously?
Sure. I mean, I think that the flip side to all of the work that we do, beautiful birthdays, is that people experience loss. It's part of the nature of birth. About 1 in 4 people will experience a miscarriage, people who become pregnant. So we don't talk about it a lot, and that can be really hard to navigate all of those things. So delivering bad news is difficult. Helping somebody, follow through that process can be hard. But sometimes we then also get the, I think, magnified joy of then a healthy pregnancy after that and a baby after loss. Sometimes we call those rainbow babies. That can be really joyful. So we get both of those things.
And one of the things, this is more of a funny story, but you don't deliver babies because that's somebody else's job. You catch babies. So tell us where that came from and the story behind that.
Yeah, I think a lot of midwives like to refer to what we do as attending births or catching babies as opposed to delivering babies. The person who's doing all the work in that room is the person giving birth. I am privileged to be there and happy to help make sure everything goes smoothly, and that's what my colleagues do, as opposed to showing up and giving you something. You're doing all the work.
Interesting. Now, you talked about that you've probably done 100 babies as a midwife, but probably have been at about 500 or 600 other births. So, that's an incredible number. Even as Corbin and I were saying, going, wow.
Yeah, being a part of birthdays is always fun. Most midwives start as labor and delivery nurses or other kinds of nurses, but often we have that labor and delivery background. And I would love to give a shout out to our amazing staff of nurses at Carle Labor and Delivery. They are fantastic, and we could not do the work that we do without their one-on-one bedside support to our patients. And I think that's where you really get the love of hands-on labor, is working at the bedside, kind of in the trenches of labor and birth.
I would agree. My first one is alive because of Carle, so I understand completely. In the future, I guess the question is, when people are, know they're going to have a baby, at what point do they have to come to Carle to find out about the midwife program, or how do people know? I honestly didn't know that much about it.
Well, hopefully this will help.
Yeah, a little bit, yeah.
I'd love to spread the news. If I could wear, Ask Me About Midwifery Services shirt, I would do that every day. Anybody who has a uterus can see midwives, because we don't just do prenatal care. Like I said, we do annuals and those sorts of things. So you can enter care at any point in your lifespan if you have a need. Yeah. And then if someone is planning a pregnancy or finds out that they're pregnant, all they need to do is call our office, 217-383-6434, talk to two of our excellent front desk staff ladies, and they will help you navigate the process, make sure you're an appropriate candidate for our care, and get you scheduled for that visit.
Are there certain people that you think for sure need a midwife because of their lot in life, or where they stay, or where they're at?
I think everybody could use a midwife. But certainly people who really want a low intervention experience in their birth and pregnancy, doing only what is really required, really following best evidence. Maybe they don't want medication during their labor and birth. Those people are great candidates for our care, because that's some of our favorite kind of work to do. I also think that patients who maybe are poorly resourced could benefit from midwives, because we can give them a little more attention. We can identify some of those psychosocial needs and put people in touch with the resources, like our Healthy Beginnings program. Also, a lot of our midwives have special training in mental health, especially perinatal mental health, which is just mental health related to pregnancy and childbirth. And so if you're already struggling with depression or anxiety, or you did in a previous pregnancy, we can provide you a lot more resources than maybe your primary care doctor can.
Okay.
Now, this might not exactly be a question for you. When I was looking at the Carle website and some of the midwifery services they offered, there were some classes and services for new mothers. Do you know what some of those are, or is that not your department?
I believe, and I could be incorrect, but I believe that the person who was doing a lot of that just retired. I do believe all of that information is available on the baby website.
Okay.
There's also a ton of great information available online. After COVID, a lot of those resources did become virtual. Also, for people who are, especially first-time parents, wanting a little bit more information, more education, more of that in-depth stuff, we are restarting our Centering Pregnancy program in the spring. Centering Pregnancy is a prenatal care model where instead of doing the 20 or 40-minute visits one-on-one, you are kind of lumped together with a group of people who have similar due dates, and then you all come together for a longer prenatal care session, often in the evening or afternoon, where we can really dig into some of those bigger issues that surround pregnancy and parenthood.
Odd question. How many babies are born every day on average at Carle?
I believe that it's about 250 per month. So some days we are full to the rafters with moms and babies, and sometimes not so much, but we never say that things are quiet or boring.
One of the things that came up in some of the research as well was that insurance, does it cover midwifery? Or how, I mean, because insurance is always the big thing right now in the world we live in, unfortunately.
With very few exceptions, we should be fully covered because we are medical professionals, and if you are covered to be seen at Carle, you should be covered to be seen by the Carle nurse midwives.
Have you ever had we always talk about the good stuff, but have you ever had something where you just didn't get along with the mother-to-be and you had to like switch, or they had to switch? I mean, does it happen? I mean,
I'm sure that it does happen. I think by and large, if you walk into a room and you give the patient your very best efforts and you take good care of them, they can forgive you for personality clashes. And also, like I said, those excellent bedside nurses can make all the difference. And so if we really don't get along, I can just come in when I need to. But for the most part, we really love our patients. We have some of the best, so that doesn't happen very often.
And then talk about your schedule. I mean, being a midwife, obviously you have to be on call at some point because babies just don't come at 3 p.m. like we want them to, right?
Sure. Yeah, I love those, breakfast to lunchtime babies. But currently we have a kind of varied schedule. But most weeks we take a 24-hour call shift, just like our docs do, and then we have a couple of 8-hour clinic days. So we get to build those relationships, and then we get to do, like I said, the fun work, but often difficult work of catching babies in the middle of the night.
There you go, Corbin.
Have you seen an increase or decrease or just staying the same of birth rates recently? Because I know that's been some hot topic.
Oh, that's a really interesting question. I do think this year we have maybe done a few fewer births just because generally the numbers are slowing down. But I know that during COVID we had like a little baby boom there. And I have a 3-year-old, so I was part of that. Yeah, I think it's maybe staying the same. Maybe it ebbs and flows a little bit, but our busiest months are the summer and September, and so when those days are over, things get a little calmer.
If it's not too personal a question, did you have a midwife when you gave birth?
Oh, does a midwife have a midwife?
Yes. I was not a midwife when either of my children were born. I was a labor and delivery nurse for that. And yes, my babies were caught by Carle midwives.
That's a great question.
That's a great endorsement, too.
There you go. Oh, man. I was reading also, I don't really understand this question, but I thought I could not ask it. There's different philosophies about childbirth. Can you talk about yours, or does Carle have to have one that they give to all of you? How's that work?
I think that the midwives approach things in a very generally homogenous way. And that way is that it's patient driven. So our ethos is very much, we're going to give you education and support. We're going to help you make evidence-based decisions in ways that work for you. So we provide information and then we support your decision. We very much as midwives are kind of hands-off, but personally hands-on, so we don't intervene, order extra things, do extra testing, extra interventions like medications or inductions if they're not medically required. But if they are, we certainly will talk to the patients about the risks, benefits, and alternatives of any of those things, and help them understand what their choices are, the recommendations we're making, and then allow them to make decisions related to their care.
At Carle for midwife, do you, are all the births at the hospital, or can they do home births?
Yes, at Carle, our provider group only delivers in the hospital. Certainly there are midwives in the state of Illinois who do home births, but that is not a part of our practice.
And then what about water births? Is that available
We do
at Carle?
not have water birth at Carle. However, there are showers and tubs in every room, so if you want to labor in the tub, that hydrotherapy provides excellent relief.
Okay, just curious about some of the rules. What do you advocate for lifestyle changes for pregnant women so they can give the best and cleanest birth? I
think the first thing is to get prenatal care that works for you, where you feel supported and listened to. I hope that's with Carle midwives, but whoever it is, enter prenatal care with someone that you trust. It's important to have a balanced diet. Nothing is super off limits except for things that are raw or undercooked, things like raw sushi, undercooked meat, stuff like that. But balance is really important. It's also important to drink lots of water. If I could tell all pregnant people one thing, it would be please just drink more water, because it causes cramping and contractions and increases your risk for UTI, which is a huge issue in pregnancy. So drinking more water and exercise. In that early part of pregnancy, that fatigue is real. That will hit you hard and knock you out. The only way that we really have to fight that is with exercise, which seems so counterintuitive. But if folks can just get moving, that will help with their energy and help them feel better, help with that nausea a little bit. And as you start to feel better through the pregnancy, continue that. It reduces your risk for gestational diabetes, gestational hypertension, and other complications that can come with pregnancy. And you will physically and emotionally feel better if you can just get moving.
Interesting. There you go.
I was talking to one of my friends in preparation for this who has a friend who is a midwife, and she said that her friend would make playlists for like the mothers to listen to while they're giving birth. Is that a thing? And if so, like what songs do you see are popular right now to listen to while giving birth?
Some people love music and some people find that overstimulating. I recently had someone who had headphones on the entire time that they were laboring, and
really?
that seemed to work really well for her. I listened to music.
She didn't have to listen to her husband. Huh? Right?
No, he was great. So she didn't have to listen to me, I think. No, she did great, and that helped her be in the zone. I listened to music when I was in labor with both of my kids. But it depends on if you're going quickly or having like a long induction. I've also seen people watch movies, sometimes play video games, often watch whatever bad movie is available on TV. But I think music is really powerful, and if it helps someone tap into their strength or stay calm or stay focused, I love music. Bring music.
So you catch a baby, and you're in the room, and how long do you stay in the room with the family and the baby, or is there like like 90 minutes? It's kind of time to ease out, or how's that work? The process.
So typically, the midwife will stay in the room just until all of the pieces of delivery are done. Placenta is delivered, any repair is taken care of, and everybody is medically stable. So in that first period, moms are at risk for increased bleeding and things like that, so we watch for that. But once everybody's stable, I stay in chat, answer questions, explain anything unusual that happened during the birth, and then I skedaddle because usually I have more than one patient, and also usually I feel like they just need time to bond.
Yeah, I get it. Yeah.
We leave mom and baby together for that first 90 minutes to 2 hours, and they stay on labor and delivery with their labor and delivery nurse, again, to watch for those complications and to facilitate bonding and breastfeeding if that's what mom wants to do. And then they go to postpartum where they get regular care, but it kind of spaces out as in frequency.
And then how often do you check in? Are you checking in still?
Absolutely. During this day, we usually check on our patients every day, although most of our patients go home at about 24 hours.
You answered my next question. I've heard that they're taking babies home earlier and earlier right now, right?
Yeah, I think that we found that we're not getting a lot of benefit over extended hospital stays. So as long as mom and baby are well and are able to come to, those pediatric appointments and follow up with midwives as needed, it's perfectly safe to go home and continue all of your recovery in your own bed, with your own food, with your own clothes on, all that stuff.
If you're just tuning in, we're talking to Zoe Due. She is a midwife at the Carle Foundation Hospital, and we're talking all about babies and midwife, and Corbin and I are learning a lot of stuff. So Corbin, what's on your mind next?
Another thing my friend told me that her friend who's a midwife does is that some of them get tattoos to celebrate milestones for baby catching. Have you seen that done? Have you had it done yourself?
So tattoos and midwifery go together like you would not believe, like peanut butter and jelly. Oh, yeah. It's common in the school that I went to Frontier Nursing University. When you go to what's called clinical bound, right before you start your in-person work, everyone goes and gets a tattoo at this little tattoo parlor in nowhere, Kentucky. I did not do that, but many of my colleagues have tattoos related to their work as midwives, related to their role as mothers, and I do have a tattoo. It's a matching tattoo with my best friend who is a labor nurse.
There you go. How long have midwives been a thing in hospitals in America? Have they always been around? Or when I heard midwife, I for some reason think about like 1700s. I don't know why.
Well, midwifery is an ancient profession, right?
Okay.
We've always needed someone to attend births.
Yeah.
And traditionally, midwifery is done, of course, by just someone in the village who has some training. Different from, medicine, and medicine is sort of a nebulous field until maybe the early 20th century. Midwives caught babies and catch babies globally. Midwives have been present in the United States since humans were present in the United States, although certain different groups, like indigenous people, have different traditions. European immigrants have different traditions, and also formerly enslaved African folks have a different tradition of midwifery as well. And those roots really support the work that we're doing now, where it's about the woman, it's about the family, it's about supporting what's natural and normal rather than finding problems and intervening. And then midwifery as a profession, a licensed profession, that kind of swings into popularity in the 60s and 70s when women are taking back agency of their body a little bit. And certainly more and more as we were able to do distance education with the advent of the fax machine and the internet. Now midwives are spreading again. I think people are learning more about the work that we can do and the care that we have available, and they're seeking us out.
Are there any risks to being a midwife in terms of legalities in terms of babies or anything? I mean, always want to talk about all the subjects. So are there risks in that room?
Well, sure. I think being a person present at a high risk situation, there are some old adages that you're never closer to death than the moment you're being born. Birth is by and large very safe. I don't want people to be afraid. But bad things can happen. And when something bad happens to your baby, that is emotionally devastating, but it can also change the trajectory of your life. And so it is a profession that is, we're highly sued, and so are obstetricians and gynecologists. I think midwives probably less because of the kinds of relationships that we build with our patients. We're able to explain things as we go, and because it's more collaborative, I think people understand the care that they're giving, so they understand the outcomes differently. That's a difficult part of our work. So we do things like document and have deep conversations about risks and benefits.
When you're sitting down with a woman who's going to give birth and you're going to be the midwife, what kind of questions do they ask you? What does the mom ask you?
When can I get my epidural is a common one. But also, what if I don't want an epidural? And that's a great question too. I want to breastfeed. How can I be successful? Should I be getting these shots? Should I not be getting these shots? Things like that. And people have questions about that sort of stuff. And I also try to steer them to preparing for the postpartum period, which is really much harder than the birth. Talking about building your village, thinking about people who are going to be on your team. And I like to tell new parents to charge admission to see the baby. No one's coming in the house without bringing you some food, some coffee, doing some dishes, mowing the lawn, taking the dog out, because mom does not need you to cuddle that baby. She can do that. It's all the other stuff that she needs help with.
Laundry and all that stuff, mostly for single moms, too. It's even tougher, right?
Absolutely, yeah.
We have about 6 minutes left. Corbin, other things on your mind?
How did midwifery change during COVID? Everything in the medical field changed in that time. What was that like?
Yeah, I think one of the things that we did at Carle was expand our telemedicine visits. Not everybody needs to be in the office for every single visit, and some of those visits are pretty much just a check-in, how you doing, how are things going. Maybe you get your ultrasound and then we call and chat about it instead of spending more time in the office. And we've continued to use some of those telehealth services because they just work better for some of our patients. I also think we've seen a trend for fewer people in the delivery room, which I think has a lot of benefit to mom's focus. I think if having everybody in there is helpful to you and it gives you energy and makes you feel supported and safe, absolutely bring your family. If that is distracting and troubling to you, leave them at home and you can use our visiting policy as a shield. I'm happy to be a bodyguard, always.
After the baby is born, some tips for mom and the baby in terms of diet, exercise, and still drink a lot of water, I assume?
Yes, please drink a lot of water. And don't feed your baby any water. Babies only need breast milk or formula and nothing else for the first 6 months.
Right. I don't think I knew that, and I feel terrible that.
Well, as long as you don't have a newborn at your house, it's okay.
Trust me, we're done.
I want moms to focus on taking care of themselves and their babies and noting that that is a full-time job. We have a lot of pressure from our culture to bounce back, to work to a certain body shape, and when your body makes another human, it's different. It's different forever, and that is beautiful and okay. Don't focus on losing weight. Focus on nourishing your body with foods that taste good to you, foods that are convenient, like granola bars and oatmeal, which fill you up and help you stay full all day. Let other people help you. It's very hard for, I think, a lot of women, especially Midwestern women, to ask for help and accept it. Please ask for help and accept it when it is given. That is really important.
There you go. That's a good answer.
I'm all wrapped up over
You're all
here.
wrapped up. Anything we missed? We have a few minutes left here with Zoe Due from Midwife at Carle that we missed that you'd like to get the word out?
I would love to tell you about all the places you can see a midwife because
Okay, go ahead.
we deliver our babies in Urbana, and you can certainly see us in clinic in Urbana, but we also go to Danville, Rantoul, and right down the street here in Mattoon. So if you're a little farther flung from Urbana, we still would love to see you. And we don't just take care of pregnant people. We also do well woman care across the lifespan. So if you are entering menopause and you have questions, we've got answers for you. If you want to talk about birth control, if you want to talk about getting pregnant, maybe some fertility questions, we can help you with that. We have providers who do gender affirming care, and we can do PAPs and mammograms and all that kind of stuff. So if you have a uterus, you can make good use of a midwife, and we are happy to see you.
And I guess how long the training was 2 years, then you went to a 4-year school, then a training afterward? Or
Well, I have a long saga of college. I have a bachelor's in nursing, and then you get at least a master's in nursing, which is a 2.5 to 3 year program, depending on how you do it. Several hundred clinical hours, and you have to catch 50 babies.
There you go. And you're way up there right now. All right, we're going to ask unrelated, well, some of it's related, more fun questions, all right?
Okay.
And we'll let you play too, Corbin, all right? Is that okay?
Yeah.
Some of them will apply, some of them might not. All right, well, this is a tough one. The first one you have to answer.
Okay.
You can't be your own kids' names either.
Okay.
Your favorite baby name that one of your midwife that your women have given.
I knew you were going to ask me this question because I love my daughter's name. It's so weird and silly. I have seen a lot of Eleanors and Henrys, and I love that. I think those classic names are really popular.
Got a favorite?
Oh, no, I don't know.
Well, what do you remember about Charleston? You're a Charleston High grad.
Oh, yeah. I mean, that I can share on the radio, all kinds of good stuff. I was a speech and drama kid, so I remember.
Oh, we have a lot of those here.
Oh, yeah.
Lots.
I remember spending a lot of time in the auditorium, and driving down Main Street. I went to the Jack and got a tea before I got here. So all those famous, familiar places are still here.
That's cool. Did you have a New Year's resolution this year?
Yeah.
Will you share? You don't have to. Will you share?
Oh yeah, absolutely. To delete all of those spam emails and unsubscribe, because I think junk just piles into us digitally, and also to say no to stuff I don't want to say yes to more often.
Corbin, do you have a New Year's resolution?
Be nicer.
All right. Could you deliver a baby on your own in an emergency situation?
Absolutely.
Corbin,
I don't think so. Call me crazy.
This is a question. I mean, obviously you're very in touch with the families. Have they ever allowed you to name a baby?
No, I did once have a patient name their baby Zoe,
awesome.
But it was not because of me.
Oh,
They
I would
already
take
picked
credit.
that out.
Would you do it though if they said, "Hey, we would love you to name them or the middle name or something"?
If they wanted to use my name, they are welcome to it, but that's too much pressure.
We asked this question. You can't midwife triplets. We know that. How about advice to an Eastern student or maybe a student anywhere that's interested in midwifery?
Oh yeah, get your foot in the door. There are lots of doula programs where you can support people who are going through labor and birth, and you can learn about whether or not that's a world you want to enter, because it might not be what you think it is, although I think it's wonderful. You need a nursing degree, so get that foundation in sciences, and learn to love staying up late.
Good point. All right. Now, what role do dads have in this? We've talked a lot about moms. The last question is kind of a dad question.
Yeah, dads and support people can really provide so much benefit. I know how to tell people generally how to get through this difficult situation if they're in pain or it's hard or they're tired, but nobody probably knows you better than your significant other, right?
Exactly.
So that person can, rub your back, bring you water. I always tell dads whatever kind of like chapstick they need, that's something to keep in your pocket.
There you go. Real quickly, the number if somebody wants to get hold of the midwifery program?
Absolutely. 217-383-6434.
Well, thanks for coming in. Great to meet you, and have a great day, everyone. We are WEIU.